Now students, today we are going to start with the autocoids. In autocoids, what are the learning objectives? We have histamine, then serotonin, then prostaglandins and leukotrienes. After that, we will also do the drug therapy of migraine, then NSAIDs, and drug therapy of rheumatoid arthritis and gout. So this we will take in two parts, part 1, part 2. Part 1 I'll cover histamine, serotonin and migraine. Part 2 I'll cover PGs, NSAIDs, rheumatoid arthritis and gout. ठीक है, तो ये हमारा लर्निंग ऑब्जेक्टिव्स हैं अभी के. सो सबसे पहले समझते हैं ऑटोकॉइड्स. नाउ ऑटोकॉइड्स आर बेसिकली सब्सटेंसेस विच आर प्रोड्यूस्ड and also act locally. Okay, right? Now in this we have again a classification. So amines are basically histamine and serotonin. Lipids are basically prostaglandins, leukotrienes and PAF. And peptides are basically bradykinin, angiotensin and calidin, right? So this is the classification of autocoids. Okay, amines, lipids and peptides. Now let's focus first on histamine. Now this histamine, how is it formed? So there is a substance which is called as histidine. This gets converted into histamine by the enzyme which is called as decarboxylase. Okay, so this is the enzyme decarboxylase which converts histidine to histamine. Further, histamine is then metabolized and then it produces indole acetic acid and N-methylhistamine, and this reaction is all mediated by the MAO enzymes. Okay, now this histamine is stored in mast cells. ठीक है, histamine बनता है और mast cells में store होता है. Now coming to the receptors of histamine, all the receptors are G protein coupled receptors. This is the first thing. Then we have H1, H2, H3 and H4. These are the 4 receptors of histamine. They all are G protein coupled receptors. ठीक है, अब एक एक करके इन receptors को देखते हैं. तो H1 is present on smooth muscles and it causes contraction. Like intestine में contraction करेगा, uterus में contraction करेगा, airway में contraction करेगा. This is the action of histamine. Then it is present on blood vessels, and blood vessels पे it causes release of EDRF, which is NO, nitrous oxide, so it causes vasodilation. ठीक है, adrenal medulla में it causes release of adrenaline, ganglions में it causes stimulation, and brain में it causes impulse generation. ठीक है, then coming to H2 receptor, this is present on gastric glands, and on gastric glands it causes secretion. ठीक है, so how does it cause? It basically increases the activity of hydrogen potassium ATPase enzyme and causes increased HCl, increased acid secretion. Then blood vessels पे it causes smooth muscle relaxation and that causes vasodilation. So this vasodilatation is slow and this is fast and prolonged. Okay, then heart पे it increases the heart rate, increases the rate of contraction, increases the contractility. Uterus पे it causes relaxation. ठीक है, H3 receptor is basically a presynaptic receptor. Okay, and so it actually reduces the release of histamine. Presynaptic मतलब auto receptor है, तो it basically reduces histamine and antagonizes histamine's action. In the brain, it maintains wakefulness, right? And because of this action, there is a drug, I'll write it in red, that the drug's name is Piprolicent and another is Pitolisant. These drugs are approved for which disease? Narcolepsy, right? So this is very important point here. H4 receptor is basically present on hemopoietic cells and it plays a role in chemotaxis. Okay, now इधर ही मैं आपको इनके एगोनिस्ट और एंटागोनिस्ट बताने की कोशिश करती हूँ. So agonist of H1 is beta histine and this beta histine is used in vertigo. ठीक है, एंटागोनिस्ट आते हैं मेपाइरामिन and chloramphenicol. ठीक है, सिमिलरली H2 के एगोनिस्ट हैं डिमाप्रिट एंड इम्प्रोमिडीन एंड एंटागोनिस्ट हैं सिमेटिडीन एंड ranitidine, and these compounds we know that they are used in GERD, right? So this is the summary of receptors of histamine H1, H2, H3, H4. I've written in detail about what receptor, what organs they are supplying, and then what are the agonist and what are the antagonist. Next हम समझते हैं what is triple response of Lewis. कई बार इस पे questions आ सकते हैं that following are the features of triple response of Lewis. So please understand redness is because of capillary dilation. Okay. Wheal is because of exudation of fluid, right? And flare is because of redness due to arteriolar dilation. So this is the triple response of Lewis, which is seen in response to histamine. Okay. Now there are some compounds which are called as histamine releasers. What are the compounds that cause release of histamine in our body? The first is tissue damage, right? Second is antigen antibody reactions that will mediate the hypersensitivity reaction. Then some polymers. Then some surface active agents. They're also called as histamine liberators. And then we have some basic drugs. I'll write the names of drugs here because they can be asked in a question. So that is tubocurarine, morphine, atropine, vancomycin, and polymyxin, right? So these are some drugs which can result in release of histamine, and they are called as histamine releasers or histamine liberators. Now next we come to H1 antihistaminics. So H1 antihistaminics में क्या-क्या आते हैं? So H1 antihistaminics में we have first generation compounds and then we have second generation compounds. Okay. Now first generation compounds, they cross the blood-brain barrier and they cause sedation. And second generation compounds do not cross blood-brain barrier and so they cause no sedation. Okay. Then first generation compounds have strong anticholinergic properties. Strong anticholinergic property like dry mouth, blurred vision, and urinary retention and constipation, right? So these are some anticholinergic properties that are very specifically present in first generation compounds. Second generation compounds do not have, they don't have any anticholinergic properties. Okay, so this is something very important. I'll show you why it is important. So what are the uses? If we come to the uses, these drugs are used in allergy, insect bites, motion sickness, right? And based on anticholinergic activity, these are antihistaminic. And anticholinergic activity के लिए they are used in Parkinsonism, and they can also be used in extrapyramidal symptoms due to antipsychotics, right? Like acute muscle dystonias. So these are some of the uses of H1 antihistaminics. By virtue of their anticholinergic property, they are used in these particular diseases. Okay. Then let's see the drugs one by one. Now, there's a drug which is called as terfenadine. Now this terfenadine is a fastest acting antihistaminics, but what it did was it basically blocked delayed rectifier potassium channels, and as a result it caused polymorphic ventricular tachycardia, which is also called as torsades de pointes and also called as long QT syndrome. So as a result, these drugs are, this is terfenadine is banned, and this increased risk of arrhythmia is seen with which drugs? Ketoconazole and itraconazole and erythromycin and clarithromycin. So this terfenadine causes this reaction, long QT syndrome, and there's an increased risk of arrhythmia when it is given with these drugs. So in drugs के साथ देते वक्त या इसको तो देना ही नहीं होता है, terfenadine is banned now. There's another drug, astimazole, which also acts by the, which also has got the same action, right? So astimazole and terfenadine, they are now banned because of this property. Then another important thing about terfenadine. Terfenadine is metabolized to fexofenadine, and this fexofenadine is lacking this action on potassium channels. So fexofenadine is safe and we use it in many allergy reactions also, right? So this is the important thing about them. Then another drug is there which is loratadine, and it is a long acting antihistaminic, second generation. It is further metabolized to desloratadine, and this is a third generation compound. Okay, so third generation में we include desloratadine. In third generation we also include fexofenadine. These are the active metabolites. Then there's another drug, cetirizine. ये तो आप लोगों ने बहुत अच्छे से सुनी है. It is an active metabolite of hydroxyzine. Okay, then so there's one sentence that all second generation drugs are metabolized to active drugs except cetirizine and mesolastin. Okay, then we have one drug called as azilastin. This is used, it has got a maximum topical activity, and so it is used in nasal spray. Okay, then there is drug mesolastin, Avastin and levocabastin. Then rupatadine, acrivastin and olopatadine. These are all new drugs, newer antihistaminics. Now इसमें olopatadine is used as nasal spray for allergic rhinitis. Then there is another drug, alkaloids, which is used as ophthalmic solution for allergic conjunctivitis. Okay, so these are some new drugs of antihistaminic series and these are their uses. थर्ड जनरेशन कंपाउंड्स की अगर हम बात करें तो हमने देखा एक तो होता है डेस्लोराटाडीन, देन एक होता है फेक्सोफेनाडिन और एक होता है लेवोसेट्रिजिन. So levocetrizine, I'm sure you all must be very aware also, must be taking it also, must have taken it also some of the other time. Then अब इसी में एक डिसीज है वर्टाइगो, जिसको हम यहीं पे फिनिश कर लेते हैं. So vertigo we know there's a disease, इसके multiple causes होते हैं, it is idiopathic also, or the most common one is idiopathic positional vertigo, and there can be some other problems also. Let's see the drugs. So the first category of drugs which are used is labyrinthine suppressants. Okay, now labyrinthine suppressants में हमारे पास होते हैं antihistaminics like promethazine, diphenhydramine, and a very important drug is cenarizine. Okay, this is specifically antihistaminic which is used in vertigo. Then we have anticholinergics. In anticholinergic we have atropine which can be used, and then we have antiemetics because with vertigo patient has nausea and vomiting also, so that is prochlorperazine. Right, then second vertigo suppressant is beta histine, which is in the name of Vertin. It is very commonly used. Then to reduce the labyrinthine pressure we can use diuretics like acetazolamide. Okay, then we can use anxiolytics, they will reduce the anxiety which is associated with vertigo, and then if it is still not controlled we can use steroids. So this is the therapy of, these are the drugs which are used in vertigo: antihistaminics, anticholinergics, antiemetics, beta histine, diuretics, anxiolytic and steroids. They all can be used. So this is the completion of histamine. Next we take serotonin. Now let's see serotonin, right? So in serotonin सबसे पहले हम पढ़ेंगे serotonin का synthesis and degradation, right? Now serotonin is basically synthesized from tryptophan. Tryptophan is an amino acid, and this tryptophan is converted into 5-hydroxytryptophan, and this 5-hydroxytryptophan is converted into 5-hydroxytryptamine, which is serotonin. This serotonin is further metabolized by MAO enzymes and it forms 5-HIAA, which is a metabolite, 5-hydroxyindole acetic acid, and this is then finally excreted into the urine, right? So this is how serotonin is synthesized and it is metabolized. Now serotonin is mainly, synthesized in cells, platelets, enterochromaffin cells which are present in the gastric mucosa. Coming to the receptors, now the receptors of serotonin are very, very important, and yes, there are a lot of receptors, so we need to understand them properly. Okay, so the receptors that we have are 5-HT1, 5-HT2, 5-HT3, 5-HT4. Okay, so let's see them one by one. Now 5-HT1 is basically 5-HT1A. It is a presynaptic autoreceptor. Okay, partial agonist of 5-HT1A. 5-HT1A का partial agonist is called as buspyron and ipsapyron and gaypyron, and this is used in anxiety, because this 5-HT1 receptor is present in the brain raphe of the brain cells, and there it maintains or manages, plays a role in the anxiety. Okay. Then next we have 5-HT1B1D. Now this 5-HT1B1D, it causes constriction of blood vessels, especially the cranial vessels. So agonist of 5-HT1B1D is called as sumatriptan. Okay. And this, इसमें और भी हैं zolmitriptan, frovatriptan, naratriptan, and they are used in migraine. Okay. So 5-HT1B1D causes constriction, and so we have sumatriptans. Then next we have 5-HT2. Now 5-HT2 has got 5-HT2A, 2C, and this basically mediates the direct actions of serotonin. And we have antagonist of this receptor, antagonist होते हैं, which is ketanserine and ritanserine. Okay, these are the antagonists. Apart from that, antipsychotics like clozapine, the atypical antipsychotics, clozapine, risperidone, all these compounds also have antagonistic effect at 5-HT2A, 2C. Okay. Then 5-HT3. Now 5-HT3 is the only receptor which is inotropic, right? So बाकी सब GPCR coupled होते हैं. This is inotropic, and this is responsible for the reflex and indirect actions of serotonin. Okay. So this is responsible for that, and in this we have ondansetron, granisetron, tropisetron, which are antiemetics, and so they are used in chemotherapy induced vomiting. Okay. Then next we have 5-HT4. This is present in GIT, and they increase the peristalsis and cause diarrhea. And here as agonist we have cisapride and mosapride. Then we have renzapride and also tegaserud, and these all drugs are used in GRD by virtue of its action on the peristalsis. So these are the various drugs of serotonergic receptors, right? Sorry, these are all the receptors of serotonergic receptors. And now let us see the individual drugs and how they are acting and what is the action that they are producing. So now let's start with the drugs which are acting on serotonergic receptor. So the first drug we will see is cyproheptadine. Now this cyproheptadine, it blocks 5-HT2A receptor. It also blocks, and it is also an antihistaminic, and it is also a cholinergic. Okay, anticholinergic. It is said to increase the appetite, and so used in children to gain weight, right? Apart from that, cyproheptadine is also used in carcinoid syndrome and post gastrectomy dumping syndrome, because in carcinoid syndrome and in this, what happens, a lot of serotonin is secreted, and then that results in diarrhea and increased peristalsis. And another important thing with this is that related to carcinoid syndrome is pellagra in carcinoid syndrome due to tryptophan being used in producing 5-HT. Okay, so carcinoid syndrome में हमें जो दिखता है pellagra, that is because the tryptophan is being used in producing 5-HT. Then another drug is methysergide. Now methysergide is basically 5-HT2A, 2C antagonist, and also 5-HT1 agonist. Then it was earlier used for prophylaxis of migraine, but prolonged use resulted in pulmonary, endocardial, and retroperitoneal fibrosis. Okay, so methysergide is now not used because it had a tendency to cause this fibrosis. Okay, the third drug is LSD. Now LSD is basically an ergot derivative, and this is a powerful hallucinogen, and this LSD is basically an agonist at serotonin. Then there's a new drug that I would like to tell you, that is fibanserine. Right, now this fibanserine is 5-HT1A agonist and 5-HT2A antagonist. And what does it do? This is drug of choice in hypoactive sexual desire disorder in pre-menopausal women. Okay, so this is a new drug, fibanserine, drug of choice in hypoactive sexual desire disorder in premenopausal women. And there is another drug, that is lorcaserin. This is 5-HT 2C agonist, and this is used in obesity. Okay, right? Then another drug that is a new drug, comes in the category of new drug, and it is also very commonly used in migraine now, is lasmiditan, and this drug is 5-HT1F agonist. Okay, and this drug, it inhibits the CGRP, thus reduces the inflammation in migraine and reduces the extravasation of fluids also. Plus, it does not cause vasoconstriction, right? And so this drug is very effective in patients of migraine with a history of coronary artery disease. So lasmiditan can be used in CAD patients because it is not causing vasoconstriction, but it is reducing CGRP, reducing the inflammation. One more thing I want to add in this is this use in children to gain weight is an off-label use of cyproheptadine. Secondly, it is also used to antagonize the priapism caused by SSRI. It is also used in pruritus. Okay? So this is cyproheptadine. With cyproheptadine, remember the carcinoid syndrome and the post-gastrectomy dumping syndrome and the information that I have given here. Now there are some drugs which are basically ergot alkaloids. तो जब हम serotonin पढ़ते हैं तभी हम ergot alkaloids को भी पढ़ के खत्म कर देते हैं. Now these ergot alkaloids, they are derived from Claviceps purpura, and इसमें the compounds that we have are ergotamine, ergometrin, ergotoxin, then we have bromocriptine, dihydroergotoxin, ergotamine, and methisergide. Methisergide अभी हमने देख लिया है ऊपर. Right, now we know this bromocriptine is used in acromegaly, right? It is also used in Parkinsonism. It has got action on the D2 receptor. Then now ergotamine, ergotoxin, ergometrin, dihydroergotamine, methisergide we have just now seen. Now these compounds, they have action on 5-HT, they have action on alpha receptor, they have action on dopamine receptors. Due to their action on alpha as blockers, they cause vasoconstriction, okay, as alpha blockers. Then it is seen that hydrogenation decreases. So here by mistake I have written they have alpha agonistic action. Okay, they have alpha agonistic action. Dopamine के ऊपर they have antagonistic action, and 5-HT पे they have partial agonistic action. Okay, so by their agonist action on alpha receptor they cause vasoconstriction. Now with dihydrogenation, it is seen that this alpha agonist activity is slightly reduced. Hydrogenation decreased alpha agonist, right, and increased antagonist activity is there. So hydrogenated ergotamine, ergot alkaloids are better, and so because they have then less propensity to cause vasoconstriction. Okay, now the drugs which are vasoconstricting, they can cause dry gangrene of hands and feet. They can also cause coronary vasospasm. Okay, so this is the activity. These drugs, ergotamine and dihydroergotamine, they are used in acute attack of migraine. Okay, but they are contraindicated if the patient is ischemic heart disease. Then dihydroergotoxin can cause dementia. Dihydroergotoxin is used in dementia, right? Bromocriptine, as we have seen, that bromocriptine is used in acromegaly and Parkinsonism, and methisergide also was used in prophylaxis of migraine. Okay, so this is about the ergot alkaloids, ergometrin, ergotamine, ergotoxin, bromocriptine, ये सब होते हैं. इनके अंदर alpha agonistic, 5-HT, partial agonistic and dopamine antagonistic action होती है, and they cause vasoconstriction, because of which they can cause dry gangrene, and they are used in treatment of acute attack of migraine, but to be contraindicated in ischemic heart disease. Now let's see migraine. The next thing that we have to start or complete is migraine. Now migraine is a very, very common, it's a headache. I have even taken a separate video on drug therapy of migraine. If anybody is interested, you can go and watch that also, where I have explained in detail about the treatment and pathophysiology of migraine. So migraine is basically what is it? It is a unilateral pulsatile headache. Okay, why? What is the pathophysiology? First of all, there is vasodilatation of cranial vessels, right? Second, there is neurogenic inflammation, and the main mediator of this inflammation is CGRP, calcitonin gene related peptide, which is the principal mediator of this inflammation, and all because of this there is extravasation of fluid also, which further causes pain, and there is stretching of pain receptors. So all these things together, then they result in that migraine. Now we all know migraine, classical migraine hota hai jisme it is plus with aura. So aura means there's photophobia and bechani and some irritation kind of thing, and then slowly this headache starts. Okay, so now what is the if it is mild to moderate migraine. Now mild to moderate migraine mein the drug therapy is mainly NSAIDs. We just give NSAIDs, that is the painkillers. If it is severe migraine, severe mein then we give, what is the drug of choice? Sumatriptan is given, and iske options bahut sare, naratriptan, provatriptan, zolmitriptan, rizatriptan, right? There are many triptans. Then alternative of this is we have ergot alkaloids, ergotamine. Okay, but it is not very preferred one. Now both these drugs both cause vasoconstriction. Of course vasodilatation ho raha hai migraine mein, to vasoconstriction hoga. So they are contraindicated in patients having CAD and hypertension. Hypertensive patients में और heart disease के patient में फिर आप इनको नहीं दे सकते हो, right? अब और ergotamine हमने देखा कि it can even result in gangrene, peripheral gangrene, because of its alpha agonistic action. So then we have new drugs. Now what are those new drugs? We have seen earlier also. The first drug that we had seen was lasmiditan, which is 5-HT1F agonist, right? And this we have seen in detail there. Then we have CGRP antagonist, CGRP receptor antagonist, and in this we have two categories. One is Gepant and one is monoclonal antibodies. Now Gepant mein we have Rimegepant, Atogepant, Ubrogepant and Zavigepant, right? This Zavigepant is also given as a nasal spray. Oh, okay. Atogepant is approved only for prophylaxis. See, this is an important point. Atogepant is used only for prophylaxis. Rimegepant is used for prophylaxis and treatment. It is approved for that. Zavigepant is approved as a nasal spray. Okay. Then we have monoclonal antibodies. Now what are these? In this we have erinumab and fremanezumab, and we have galcanezumab. Okay. So these are the monoclonal antibodies which are CGRP receptor antagonist. Now out of this, erinumab is also approved for, it is also approved for prophylaxis. Okay, and these drugs, all these three drugs are given by subcutaneous injection. Plus patient's cardiovascular status has to be checked and not indicated in pregnancy. That is very important. So please see the new drugs. Lasmiditan, which is 5-HT1F agonist, and here lasmiditan has got, as I told earlier, it decreases CGRP and it has got no vasoconstrictor activity. So it can be used in patients with CAD also. Okay. Now CGRP antagonist, we have two type of drugs, monoclonal antibodies and Gepant. In Gepant we have Rimegepant, Atogepant, Ubrogepant and Zavigepant. Zavigepant is approved for use as nasal spray. Atogepant used only for prophylaxis and Rimegepant is used for both. And monoclonal antibodies we have erinumab, which is approved for prophylaxis, and fremanezumab and galcanezumab are also approved. They are to be given by subcutaneous injection. Okay. Then another drug which can be used in severe is intranasal butorphanol. When you cannot give all these drugs, butorphanol can be given in severe acute attack of migraine. Okay, then next we have what are the prophylaxis of migraine. So the first drug of choice for prophylaxis is propranolol. Okay, propranolol is the first drug. In this you can give metoprolol, you can give timolol, you can give bisoprolol, you can give atenolol, but not pindolol, because it has got intrinsic symptomatic activity. Okay, then other drugs can be methisergide, right? Then tricyclic antidepressants like amitriptyline. You can also give cyproheptadine, right? Then we can give anticonvulsants like valproate and divalproate and topiramate. Okay. Then there's an ARB that can be used, which is candesartan. Then CCBs, which is flunarizine. Verapamil can be used. Okay. Then clonidine is said to have an effect in the migraine prophylaxis. Then CGRP antagonist, as I said, atogepant and erinumab, right? So they can be, these are the drugs which are used in the prophylaxis of migraine therapy. A lot of drugs are there, and please remember all of them, because you get a question, following drugs can be given as in prophylaxis of migraine except. And then last is there is a onabotulinum toxin A, which is given in intractable chronic migraine. Okay, it is not for episodic, so you have to remember this, not for episodic migraine. It is given for intractable chronic migraine when nothing else is effective. So with this we finish the histamine, serotonin and migraine, and tomorrow then we'll do the prostaglandins, leukotrienes, NSAIDs, rheumatoid arthritis, and gout. That will finish our autocoids.